Welcome everyone to the Canadian Nurses Association's webinar series, Progress and Practice. This webinar is about the revised community health nursing standards and what home health nurses need to know. This session is being recorded for nurses who are unable to participate today. My name is Aidan Hamza. I'm a policy advisor at the Canadian Nurses Association, and I will be hosting this webinar. At the end of the presentation, we will answer your questions, which you can type in the Q&A box that you see to the right of the slide. We will address as many questions as time allows. The certificate of participation will be emailed to you along with the link to the recording of this webinar. And now a little bit about our presenter, Karen Curry. Karen is currently practice educator for VON Canada. Karen has held a variety of roles with VON Canada. Project management and collaborative practice education are her main areas of focus. As practice educator, Karen is an advocate for practice change initiatives to develop community health nurse capacity. Palliative care, wound care, and nursing leadership are her key practice areas of expertise. Karen is an active member of the Community Health Nurses of Canada and currently chair of the CHNC Conference Program Committee and the Standards and Competencies Committee for CHNC. And now over to you, Karen.
Great, thank you. Am I unmuted now?
Yes.
Oh, perfect, great, thanks so much. So I'd just like to begin by thanking CNA for this opportunity for CHNC to present. I do want to recognize that we're going to be talking about this revised standards of practice. And this was a result of some scoping review that looked at current evidence to develop 8 community health nurse standards. A total of 462 community health nurses across the country participated in a modified Delphi method. As well, there were 195 questionnaires completed. And as well, the conference committee did do some focus groups at our conference in 2018. So there was lots of opportunity and participation for community health nurses to provide input to the development of these standards. Next slide. So I'm really happy to be here. I've been involved with CHNC since my first conference in 2011 here in Halifax, Nova Scotia. I've met some wonderful people, met people from across the country, as well as in different areas of practice, and consider many of them really good friends. So if any of you are on the line here today, I've certainly enjoyed all the folks that I've got to meet and work with CHNC. So the objectives today are to share particularly the standards from a home healthcare lens. That's where my expertise lie, and the majority of my clinical practice have been in the home healthcare environment. So you can say I found my home in home healthcare. And in my professional practice role at my organization, I'm immersed every day in standards and practice and changing evidence. So I'm really happy to be able to provide an overview of these standards for folks here today. Next slide. So just a little bit about CHNC, or Community Health Nurses of Canada, if you're coming to this kind of inquiring and wondering about CHNC. It's a volunteer professional association whose members represent community health nurses in every province and territory in all areas of practice, from administration, education, and research, from coast to coast to coast. And our members work in a variety of practice settings, including home health, public health, primary care, primary health care, correction centers, community and community mental health settings. And one of the things I think we still are challenged with is to bring awareness that Community Health Nurses of Canada is not just for public health. Certainly the history and the wealth of information that public health nurses have brought to CHNC is a good foundation, but we have expanded, and there is lots of opportunity for those who work in different areas of practice within community health nursing. In CHNC, the focus is to advocate for the strengths of community health nurses through the development of standards, competencies, as well as a certification with the Canadian Nurses Association, and to support professional development of community health nurses. The key areas of focus are health, partnerships, and collaborations with other organizations that enable community health nurses to have their voice on important health issues in policy in Canada. Next slide. So this slide just really gives an overview of looking at the different areas of community health nursing. So again, focusing on home health, the big focus on home health is prevention, restoration and maintenance and palliation. And the main focus is on individuals, caregivers and their families, with a big focus on supporting them to maintain their health at home, self-management support, client teaching, and helping them to access resources in their communities in order for them to stay home safely. The next slide provides an overview of some of the key unique characteristics of community health nursing. And those of you in community health nursing, none of these come as a surprise. And when I first was helping the committee put together this slide, it really brought back to me why I enjoy community health nursing, and particularly home health nursing, because of the uniqueness in the practice setting. So this goes over a number of different areas, which looks at how community health nurses are unique within other areas of nursing specialties, as well as the uniqueness within community health nurses themselves. So one of the key things is that community health nursing, broad scope of practice that work with not only individuals and clients, but with the broader set group of communities, overarching health and entire population health. Another unique thing in community health nursing is that we meet people where they live, where they work, where they learn, where they worship. Mental health, outreach, street nursing, homeless shelters, some of the clinics that are set up in some of the larger centers for harm reduction. This is where a community health nurse works. But it's important, this also comes with some challenges that I think those who work in community health, it's that uniqueness and that challenges that keep us going. It's looking at, the environment of where we work can be quite different because it's often based on the context of the space or the home or the program or area that we're going into. We have a lot less distractions per se. We focus on one person or one group or one program at a time than if you're on a hospital or a long-term care unit. Unpredictable situations are the norm. Flexibility in planning your day is a big skill for community health nurses. Going into the home settings, certainly not one is unique, and you always have to be very aware of your environment, environmental risk screening, and not just a one-time thing, which I think is very important, that community health nurses, particularly in the home setting, need to be aware of what's going into where they're going. Coming in contact with all kinds of different people, and learning to work virtually with other healthcare professionals. We may not see them in the setting, but we often have phone calls, conference calls, team meetings that are virtual, and learning to trust in how we can all contribute. The focus for home health care, for us in community health, is looking at how do we support and focus on health, focusing on how we can provide the resources to support people. And one of the biggest things I think community health nurses enjoy and realize very on, if it's for you, is the independence and the autonomy. The knowing that you need to be very strong and balanced in your skill set, being aware of your environment, your resources you have, how to use your supplies properly, using the technology you have. You may not have as much as folks in other areas of practice may have as well, but yet focus on that client getting the job done. Working in different environments, the community health nurses have to have an expertise of understanding the determinants of health. Research is continually showing us that this has a big impact, and we see it in our work every day. We do the best we can to advocate, to work within our systems, and ensure that we're meeting clients where they are. Partnerships and relationships. This is a huge part of all community health nurse practice, but particularly those in home health care. You're developing relationships with your clients and families. You're building a virtual team with your coworkers, as well as your coworkers that are in other teams that may be a consult team or an expert team that's providing support to your practice environment. So these unique characteristics of a home health really, community health nursing really hit home for me in terms of how home health fits all those boxes. So the next slide, looks at where does these community health standards of practice, where do they fit into the context of all the standards that we have as regulatory nurses. Well, of course, as each nurse, no matter what province you're working in, you have a standard of practice. You have your regulator that sets the specific competencies that nurses need to have. So the CHNC standards are over and above and kind of expanding the depth and breadth of the provincial standards, defining the specific expectations of nurses in the community. So really highlighting and zoning in on what is different about working in community health. The competency sets look at the knowledge, skills, and judgment you need to work in different practice settings. So we have home health competencies, public health competencies, and family practice competency sets that are derived from the standards of practice for nurses, and it helps to support the individual uniqueness of the work that we do. So if you're not familiar with the home health competencies, I would encourage you to take a look on the CHNC website, a great source of resource for home health agencies. So let's look at the overview of what's in these standards for 2019. When we look at these standards, we have the 9 standards set out here, sorry, the 8 standards. The first 3, the health promotion, prevention and health protection, health maintenance, restoration, and palliation. These are what nurses do. The other pieces that surround the standards are how we achieve that. So we achieve that by creating health equity with our clients, building capacity for our clients and families in their communities, professional relationships, evidence-informed practice, using that to inform our decision-making and work with our clients, and professional responsibility and accountability. So on the next slide, we're looking at, and I think this is a big question, and myself in professional practice and trying to engage folks in my organization with all the busyness and responsibilities and operational issues that we have in home health. Why do these standards matter? What's important? And I think for me, when I saw this again, this bundle, I thought, you know, it's really an important piece for us in home health care specifically to look that, you know, we have a place within community health, that our goal is to inspire excellence and commitment to community health practice. And the standards give some flexibility. Yes, we do hire new grads in home health, support them to build their competencies, but the standards give 2 years of, for folks to come up to those standards. So entry level, and then you learn the uniqueness of community health, and particularly home health in my area. They also promote community health nursing as a specialty and provide a foundation for the certification as a clinical specialty with the CNA. So I would encourage you to consider CNA certification in community health nursing if you haven't already, or support folks within your team to do so. It also establishes some expectations for safe and ethical care. And in home health, particularly, some of those issues about risk and right to live at risk and some of the ethical and safety issues we come into, these standards help us to frame them, look at ways to mitigate risk, and focus on what's best for our client and family in that particular context. Defining the scope and depth of community health nursing practice helps us to be able to identify, to explain, to talk about why home health or community health is unique from other practice areas. And I know particularly in my role in home health, I'm often spending time working with funders or working across the system to really identify the uniqueness that we do in home health and some of the benefits we can bring, and then also some of the challenges that people working in acute care or other agencies may not realize that we have in home health. Supports human resource management by providing a criteria for for measuring performance. So many organizations or many community health nurse leaders are advocating within their organization to adapt and embed some of these standards into practice reviews, into job interviews, into performance reviews. And as well, in terms of looking at nursing practice, the standards help to strengthen education and professional development by providing a foundation to develop our competencies. Next, I'm going to talk a little bit about some of the methodology to revise these standards. And as I mentioned at the top, they are evidence-based. There was a lot of work and thought and expert consultation put into the development of these standards. In 2018 to 2019, a review process started. There were 7 focus groups. There was a World Cafe that had 35 community health nurses at our conference in 2018, and a Delphi consensus process was used. There also was a scoping review to, this looked at the current literature and compared the 2011 standards. There was a framework that was used, and the search identified 147 articles to look at. The review selection and data extraction were performed by a research team consisting of 7 independent reviewers, and they looked at the existing 7 as a guiding framework. So after their data analysis, they looked at the subcategories, made some changes, and helped develop some descriptive ideas to help support the development of the revised standards. And the feedback and input from community health nurses supported this evidence and research. So now let's look at what's new in these standards. The final 2019 Community Health Nurse Standards consists of 8 domains and 81 standard statements. The new standard practice is evidence-informed, and this includes 7 new standard statements, as well as 1, including evidence-informed practice, such as knowledge translation and critical appraisal. As well, access and equity from the 2011 standards has been changed to health equity. So you can see the difference there on the slide from the 7 standards to the 8 with some tweaks to the health equity new name and adding in to make it very transparent that evidence-informed practice supports our work in community health. The next piece of work that was done, it was to ensure that the integration of the Canadian Community Health Professional Practice Model into the standards. The practice model was released and developed in 2011, and in 2013, the Community Health Nursing Professional Practice Ad Hoc Committee and the Standards and Competency Committee developed a visual of the model. And this has been included in the new standards. So the key components there, the community health nurses and the system, community organizations, community health nurse and nursing practice that support the client and family at the center of all decisions that we do. And looking at the next slide, that just gives a little bit more detail about the visual model, including, obviously our client looks at different families, groups, and individuals, and that the community health nursing practice uses theoretical, evidence-informed practice, professional regulatory standards to inform the work that we do. So now I'm going to move on and look at talking about the standards and kind of walk you through the different pieces of the standards. So next slide there, please. So the standard number 1 is health promotion. And this particularly, and I want to look in and lean into how does home health, where does home health fit within these particular standards? Obviously, there's a lot of different criteria, and I think all of these 8 standards, home health can see themselves with some more than others. But particularly with this one in terms of health promotion, the home health nurse collaborates with the client to do a comprehensive assessment, uses evidence-informed practice and strength-based holistic assessment using multiple sources and methods to set up that care plan, to assess their needs and their service plan, and collaborate with the funder to support that client in their home and community. As well, the home health nurse also considers the determinants of health, the social context of the client, and the support systems that the client has available to them. We'll move on and look at an example on the next page. So some examples here on this page of how to embed this in practice is the home health nurse encourages clients and families dealing with a chronic illness to participate in regular physical and social activities. As well, from this health promotion, home health nurses also encourage people to Seniors take part in adult day programs where they maybe get some physical exercise, some exercise programs for some frail elderly, as well as looking at different populations at what's available in the community to support their clients in reaching their goals for health. When we look at standard number 2, prevention and health protection, this one is one I think sometimes that maybe home health nurses may find a bit of a challenge in really seeing themselves, although it is part of our work more on the periphery. But it applies to looking at the client and assessing what type of levels of prevention will we be using to help support this client. How can we engage and collaborate with interdisciplinary and intersectorial partnerships to help deliver preventive and protective services for this client and family? And also as well to use harm reduction principles grounded in social justice and health equity to identify and reduce risks and increase the client's support. So on the next page, we're looking at, what are some ways that a home health nurse would do this? And some of these would be provide health teaching to people with diabetes in their management of their disease to prevent diabetic reactions. A big part of home health practice is client teaching, supporting self-management, assessing their readiness to learn. So prevention and health protection, supporting them with their chronic disease management is a big part of home health nurses' work for sure. Standard 3, I think, is the key one that home health nurses really, of course, see themselves, because Standard 3 is looking at the next slide there. Standard 3 is health maintenance, restoration, and palliation, and this essentially is the day-to-day work of any community health nurse. For myself, and I find for those of you in home health care, I find the big 3 as well related to those are looking at some of the key things like wound care, infusion therapy, and palliative care. A big part of the work that nurses do is client teaching, mitigating risks, and helping to support that client and family in living at home safely. How can we provide this care safely to this client and family? It's often the lens that a home health care nurse looks at and works with the funder, collaborates with interdisciplinary teams to support clients and families to maintain at home. One of the other challenges that home health care nurses run into with this area is that right to live at risk, particularly with seniors or clients that may have some mental challenges, is for providing care for those clients and how to support folks who are living at risk. Some of the key things that in terms of standards that fall onto this is including that cultural safety and cultural humility approaches in all aspects of health maintenance, restoration, and palliation. So being aware, informed, looking for resources to help build your education, if that's an area that with a certain population you may be working with that you need some support. So again, I did give some examples here already, but on the next page, these examples for home health care for this standard. Care for disabled students in the classroom. Communication is required with the child's guardian, parent, and classroom assistants. Many home health organizations, have nurses in the schools, whether it's a short-term drop-in to support a particular aspect of care, or it may be supporting somebody all day to be in the school. As well as I mentioned, the other areas that are big with palliative wound care and working with interdisciplinary teams. Standard 4, looking at professional relationships. This comes quite naturally, I think, to home health nurses because, in and of itself, you're not sure what you're going to see throughout that day, who you're going to meet, what's going to be on the other side of that door or that program or that who's coming into that clinic. And being comfortable to communicate, using the art and science of nursing to help make folks feel comfortable while you're doing their assessments, and making sure that you're developing good relationships, not only with your clients, supporting them in their decision making, but reaching out and developing a good team of stakeholders that you can work with. One of the key things that home health nurses do well is to respect and support the client in identifying their healthcare priorities. What's the most important thing we can do for you today is often a question that many home healthcare nurses ask during their nursing visits. And this helps the nurse to identify they may be there to do an infusion, the client may be concerned about other health issues, and by building that trusting relationship and opening that door, it helps to support that client. It also helps, to help us work across the system to get the resources that our clients need. So communication skills, working across the system, and maintaining professional boundaries and therapeutic client relationships is key. Very challenging in home healthcare, and I know I often do presentations reminding home healthcare nurses about the importance of building safe, appropriate therapeutic relationships and boundaries. So it's a key part of what we need to do in home health and in any area of community health nursing. So when you look at examples of this, professional relationships, working across the system with interdisciplinary teams, providing palliative care with a team of healthcare providers to make sure that they can remain safely at home. This can go with almost anything that we do in home health, taking home medically fragile children. We work very closely, if that's part of your program and work, with the referring hospital to ensure that the nurses have the competencies and have received that good communication and understanding of the work that we do to support their client in their home. So the standard number 5 is capacity building. I think this is a big one for all nurses, but particularly in home health, you build that strength over time. It's to engage the clients, to recognize their strengths, to encourage, to be a cheerleader, to support them, to understand their challenges and help them to meet their optimum health within their resources, within their context. Helping them to make decisions, helping them to navigate the system, supporting them to learn new skills, supporting them whether it's respite or referrals for respite services, or even grief counseling, recognizing some of that anticipatory grief, helping to build that capacity with clients and families to deal with their health issues that they have while they're in that home. I guess some of the other pieces about this is mutual goal setting, encouraging the client to have a say in their care plan. As I mentioned, what's most important for you, for me to do today? What are your goals while we're here to support you in your health? Help them to see that they have a role to play, and it's not just the nurse coming in and doing, that we really do want to work with you to support you in your health. So when we look at some of these issues, examples of capacity building, here's an example of a mother and a teens to work out a schedule for range of motion exercises for the grandmother. The family's happy that they're able to work out the problem together. So look, engaging clients and families in their care plan to assess, who can do what and support them with teaching, reinforcement, so that they're safe to take on some of that care and to be able to keep their loved one at home or support them in a program. Now we're moving on to standard 6. Now health equity, and I was really pleased that this was added and kind of spelled out a bit more broadly. It's such an important part and foundational work of what we do in community health. I think it takes I always say it takes a special person to work long-term in community health, in terms of it's not everybody's cup of tea, because you do deal with challenges across the system. You do deal with different challenges, not only critical skills, but those larger social economic challenges that, looking at it through that health equity lens, advocating, adding your voice to any issues that come up within your community, working across the sectors to identify how we can work together, break down silos, help identify areas that could help reduce the health equity between the populations you see in your community. And often the home health nurse is right there in the middle of that, as well as recognize other community health nurses. But we're in that home, we see what they're dealing with, we hear the stories. It gives us a unique lens to really advocate within our control for resources to support our clients and families in the community. And also help them to, to make choices, to make them aware of what's out there, to understand, what's going on in those communities. What are the power struggles? What are some of the assumptions that are being made? And ensure that we're always providing culturally safe care. Asking, seeking to understand is such an important role for the home health care nurse in gaining that respect to help the clients work towards some health equity in their community. So when we look at an example of health equity from a home health care lens, it's when the home health nurse advocate with families caring for medically fragile children by seeking respite care for exhausted families, by contacting their local MP, by bringing the issues forward that you see in the community, whether it's with frail elderly, housing issues, safe drinking water in schools. Those types of things are all part of things that home health care nurses can advocate, bring forward, and depending on different roles, different levels of advocacy is required. Standard 7, the next standard, is our new standard. This really, evidence-informed practice was always, I guess, assumed because, that's a key part of nursing practice, but it's spelled out to identify the unique expertise of community health nurses and the different lens that community health nurses view health and population health, and different resources from evidence. From not only nursing, but from other disciplines to support our practice. Particularly in home health care, our evidence-informed practice more focus on some of those clinical skills like palliative care, infusion therapy, wound care, and looking to what is the latest best practices, integrating them into our policies, and then integrating them into the work that we do. And often that takes some time to spread that best practice, but that's a big part of the home health care nurse responsibility, is to ensure that they're up to date, aware of new organizational policies that are based on evidence, and also take part and facilitate knowledge translation at the local level, working in small teams, large teams, to help identify moving practice, education, and research across the organization. As well as quality improvement, I think, is a big part of this piece as well. A lot of home health nurses, as well as other community health nurses, work on quality improvement projects to make some change in clinical practice or in their professional practice to help support moving things along to that standard of what does the new evidence say, whether it's palliative care, wound care, or infusion therapy, like I say, the big three that I like to call them for home health care. So some examples on the next page are looking at, as I just said, a home health nurse or a practice consultant are working on updating the wound care policy. They've looked at the best practice guideline, looked at the Wounds Canada, looked at other informed evidence-based practice to ensure the best evidence is used, and then translating that into tools to support the practice, to support the front line, to have those point of care tools to support them in understanding the change, as well as implementing that into their own practice. Sounds easy, but that is, I think, something from professional practice side of the house that I work on. That's something we're always continually looking at and trying to improve. So now I've come, and I think I'm doing good with my time. I've come up to standard 8, professional responsibility and accountability. This, of course, is a key standard in your nursing colleges and regulatory bodies. But I think for us in home health care, where we work so independently and autonomously, coming across different clinical issues, social issues, ethical issues, it's really important for nurses to identify and know what their resources are. Know, what do I need to report? Who do I troubleshoot within my organization? What resources do I have at my hands to help me make a decision here? And who do I have to involve in this decision? Do I have to reach out to other partners whether it's a funder, whether it's a social worker, whether it's a primary care provider that's been really involved in this client. So identifies and works proactively, individually, or by participating in professional organizations to address health and nursing issues that affect the client and the profession. So again, I would see involvement, with your local provincial association, as well as being involved with CHNC. And I'll talk about membership when I come to the end here. So looking at how does a nurse do professional responsibility and accountability. A home health nurse is asked by an ALS client to be present when his wife removes his BiPAP machine, which will result in his death. The nurse, not sure if that's okay. They explore the client's reasons for this decision. They discuss the ethics around it. They may even make a request to their practice consultant or to their regulatory body to see what's the best approach and are they making a good, sound decision about that. Professional responsibility and accountability for those working independently, I think, is even much more important to have that dialogue, to have those discussions to ensure that that piece is not missed. So the next piece is looking at, how do we really pull out that health equity piece? The revised standards incorporates new expectations around cultural safety, cultural humility, Indigenous ways of knowing, levels of prevention, disease management, critical appraisal, knowledge translation, interprofessional competencies, and quality improvement. Boy, that's a lot of stuff we have to take into account for sure. Well, I think this health equity lens is really important. I think nurses, community health nurses, and particularly home health, have always viewed that, but didn't have a foundation or structure to really base that on. The changes were made in the context because of the literature in Canada, looking at the changes that are going on in our context, looking at the documents like the Truth and Reconciliation Report that's made some recommendations focused on health, and that we can certainly help support that in our work as community health nurses. And community health nurses in Canada have adapted to ensure that we work towards that in all our work. And making sure that health equity is something that is really brought forward. The next page just highlights what are some of the new practice expectations, and if you're looking through the standards booklet or looking at it online, these are the areas that you'll pull these through. Cultural safety, cultural humility, Indigenous ways of knowing, levels of prevention, disease management, critical appraisal, knowledge translation, interprofessional competencies, and quality improvement. So if you're looking at the standards, these are the key indicators that would pull through these areas of practice. So when we look at how does this enhance our practice in Canada, there's a couple of examples here. I mean, looking at cultural safety, it's important for us to be aware that we communicate competently. Cultural humility, an approach that's based in acknowledgement of oneself as a learner. Seek to understand, it's a lifelong reflective practice. Being respectful and understanding, on the next slide, looking at Indigenous ways of knowing. Those who work with Indigenous cultures, see and observe how that is in work. Being aware and open to the different ways of transmitting knowledge, being aware of that Indigenous ways of knowing is embedded in the work that they do, and being respectful of that. And looking at the different layers of prevention with the additional layers of primordial and quaternary prevention. On the next page is a couple of more slides, that definitions rather, that look at some of these key concepts: critical appraisal, knowledge translation, interprofessional competency, and quality improvement. So these are some key areas I think that have been a part of community health nurse practice, definitely part of home health practice because of the work that we do and the quality improvement and knowledge translation that we do. but it's important to recognize that these are now set out in our standards for community health nurses of Canada. So I think I am coming to the end here. Just want to briefly look at, when you do get your new standards, there's a whole glossary of terms that helps identify and relate some of these concepts to community health nursing. For those of you who may be in academics or in professional practice and have engaged the 2011 standards, there's some summary at the end of the standards that talks about what are the unique differences that you can highlight as some of the changes. And as you see here on the slide, one of the key things is that there is one new standard of practice, and then looking at how do we engage and integrate that into the work that we do. So again, all this work was done in the context of literature, collaboration with community health nurses around the country, understanding and trying to integrate some of those important documents of the Truth and Reconciliation Community Commission with some of the 52, I believe, recommendations around health, and how can community health nurses lead some of that work in supporting our practice. Next slide. So now this is an opportunity to, to collaborate with me and to use the chat box. Pick one new area of the standards and describe currently a practice or education example and how you're integrating and using that in your work. So the different areas are cultural safety, cultural humility, Indigenous ways of knowing, levels of prevention, disease management, knowledge translation, interprofessional competencies, and quality improvement. So use the question and answer box and please provide suggestions to think about what you can take back to your organization, whether you're a frontline nurse, a manager, team lead, or working in professional practice or education. So some of the next steps, or what now, I would encourage you, if this is, an introduction to Community Health Nurses of Canada, or an introduction to, well, why is home health, how do we fit in terms of CHNC? I encourage you to learn more about the standards. Consider certification in community health nursing. I did the first certification in 2006 with a group of nurses. We had a study group. It was almost like a book club. We had a hoot of a time. And we all passed. And so I would encourage you, if you are doing that, to try to get a small group together to support you in doing that. If you're not aware, there is home health care competencies that are available on the CHNC website. It's a good document to support those who are in leadership in home health, to help advocate for those to be embedded into your organization. Think about if you're developing as an educator, learning objectives for your own professional development, or you're doing any new education, think about how you can relate that education to some of the community health nurse standards. How does this new project we're rolling out help you build capacity? Or how does this new evidence-based practice and guideline that we're doing help you support your clients in evidence-based practice, that type of thing. And especially for those nursing leaders, to advocate with your managers, senior managers, directors, if you're involved with CHNC, share that. Support your organization being knowledgeable about CHNC, collaborate with other nursing leaders, and support leadership and learning. And for myself, that's been my biggest reward working with CHNC. I was on the board for a number of years. I was a Nova Scotia rep. And quite frankly, I enjoyed meeting people. I enjoyed knowing what's going on. I enjoyed learning from others, learning from nurse leaders in Ontario, whether it's from an academic, Claire Bechter sharing her resource and knowledge, Katie Delwith, who in Ontario, many of you know in public health, as well as a lot of the academics in terms of their passion, their focus on community health nursing. And me, little old me in my home care world, that opened some doors to some great relationships and some professional learning for myself. So I would encourage you, you know, if you're thinking I'm already too busy, I don't have time for that, just step out and try. You'll meet some wonderful, great new people. So on the next slide, there's our information on how to get a copy of our standards, the Community Health Nurses of Canada website. I'd also encourage, you know, that they are in bulk prices if you want to buy them for your organization. This is on the next slide, please. Thank you. So the website, CHNC.ca, there is a store. As always, the standards are available on the website. New is the ability to purchase a PDF or a paper copy. There is bulk prices available for both PDF and paper purchases. The next slide, I consider a membership in CHNC if you haven't already, or consider advocating, you know, one person in your team to join you if you are a member. Again, join Community Health Nurses of Canada to ensure that you meet folks and you learn from the many membership benefits. So the registration information is there. Support your professional association and the great work that CHNC volunteers are doing. The other thing I'd encourage is we have our annual conference every year. This year the conference is in BC. You can see more in Vancouver. You can see more about that on the website as well. So thank you so much for your time today. I think I've gone over my time, but it's great to be here and to share this information with you through the home care lens.
Thank you so much, Karen, for your great presentation. Before we move on to the question and answer period, we'd like to ask that participants answer a couple short survey questions about today's webinar. Okay, we'll now start the discussion portion of the webinar. If you haven't already, please type your questions into the question and answer or the Q&A text box. So we do have one question here, Karen. The question is from Marie Gilbert. The question states, since we are in a different setting, for example, the home, do we have protocol regarding home safety guidelines prior to doing home visits, such as environmental risk assessments or other options?
That is a great question. I know I often get asked that from nurses who don't work in home health. How do you know it's safe? CHNC does not currently have any standards on risk assessments. That is an Accreditation Canada requirement. So if you are with an organization that's accredited, that is one thing they do ask. Funders often do ask for a risk assessment as well. And if different organizations would have a process for doing that. Most organizations, but it is each organization, you know, sharing what they do and ensuring that they're meeting accreditation standards is kind of the key thing. But right now, CHNC does not have any standards on that. I do believe there is some resources from the Canadian Home Care Association. They've done some research about some of that safety pieces, as well as occupational health and safety, looking at that piece. But that is a good area of, certainly a good area of research and for next standards development to ensure some standardization around that across Canada for sure.
We also have another question from Sheila Callahan. It states, any comment on how digital literacy and or digital fluency as nursing competencies fit within these new standards and community practice expectations?
That's a good question, and I know that I had actually asked that myself when we were doing the focus groups. And at that time, a lot, you know, well, that was like 2-3 years ago, there wasn't a lot of evidence yet around that piece. That's certainly an area that is growing in home health specifically, I know, as well as other areas of health. So right now, no, there's not any particular standards, and the evidence when they did the review didn't really come up with that enough evidence to put that as a new standard in terms of technology competency, that piece. But I can definitely see when we do a revision, that's definitely going to be an area I hope that there's more increasing research and evidence to support that, because it is something that we deal with in organizations for sure.
Perfect. That comes to the end of the questions so far. We would like to again to thank you, Karen, for such a great presentation, and we really appreciate it. And just wanted to remind everyone that the presentation will be shared after when it's available on our YouTube channel. If you haven't already, please consider registering for the next webinar, the Vega Project Supporting Nurses in Addressing Family Violence, which will be taking place on Thursday, February 27th at the same time from 12 to 1 p.m. And again, thank you, Karen, for your great presentation and everyone for participating today.